Question 1. A phlebotomist has collected a blood sample and forgotten to label the tube before leaving the patient's room. What is the most appropriate action to take? A. Label the tube immediately outside the patient's room and document the delay. B. Ask the patient to verify their identity again and then label the tube in their presence. C. Discard the unlabeled tube and redraw the specimen. D. Label the tube with the patient's information from the requisition and proceed. Answer: C. Discard the unlabeled tube and redraw the specimen. Explanation: This question tests a crucial safety protocol concerning patient identification and specimen integrity, emphasized by the phrase "forgotten to label" before leaving the room. An unlabeled tube, or one labeled outside the patient's presence after collection, is considered a mislabeled specimen and must be discarded, requiring a redraw. This strict policy prevents misidentification errors, which can lead to severe patient harm from incorrect diagnoses or treatments. Always label tubes at the bedside immediately after collection and before leaving the patient, ensuring accuracy and patient safety above all else. Question 2. A phlebotomist is preparing to draw blood from a patient with a history of fainting during venipuncture. What is the most important step to take to prevent a syncopal episode? A. Have the patient drink a glass of water before the draw. B. Position the patient in a supine or semi-Fowler's position. C. Apply the tourniquet for less than 30 seconds. D. Use a smaller gauge needle, such as a 23 gauge butterfly. Answer: B. Position the patient in a supine or semi-Fowler's position. Explanation: This question addresses patient safety and managing common complications during venipuncture, specifically syncope or fainting, with history of fainting being the key clue. Positioning the patient lying down, supine, or reclined with their head slightly elevated, semi-Fowler's, helps maintain blood flow to the brain, significantly reducing the risk of fainting and preventing injury if they do faint. While other options might seem helpful, ensuring a safe physical position is the most effective proactive measure for a patient known to experience syncope. Always prioritize patient comfort and safety by assessing their history and positioning them appropriately. Question 3. Which of the following venipuncture sites is contraindicated for a patient who has undergone a right-sided mastectomy with lymph node dissection? A. Left antecubital fossa. B. Right antecubital fossa. C. Right dorsal hand. D. Left dorsal hand. Answer: B. Right antecubital fossa. Explanation: This question assesses knowledge of contraindications for venipuncture sites, with right-sided mastectomy with lymph node dissection being the crucial medical history clue. Lymph node dissection on the right side impairs lymphatic drainage in the right arm, increasing the risk of lymphedema, infection, and inaccurate test results if blood is drawn from that limb. Therefore, venipuncture should always be performed on the contralateral, opposite, arm or an alternate site to avoid complications. Always check for conditions like mastectomy, IVs, shunts, or fistulas before selecting a venipuncture site. Question 4. A patient reports feeling tingling and numbness down their arm and into their hand immediately after the phlebotomist inserts the needle. What is the most appropriate action for the phlebotomist to take? A. Continue the draw slowly, monitoring the patient. B. Immediately withdraw the needle. C. Reposition the needle slightly. D. Apply a cold compress to the site. Answer: B. Immediately withdraw the needle. Explanation: This question tests the phlebotomist's response to a potential nerve injury during venipuncture, indicated by the keywords tingling and numbness. These symptoms are classic signs of nerve irritation or damage caused by the needle, and continuing the procedure or repositioning the needle could worsen the injury. The immediate and most critical action is to remove the needle to prevent further harm, then apply pressure, assess the patient, and report the incident according to facility policy. Patient safety is paramount, so always withdraw the needle if nerve pain or sensations are reported. Question 5. Which additive is found in a light blue top tube and is primarily used for coagulation studies? A. EDTA. B. Sodium citrate. C. Heparin. D. Sodium fluoride. Answer: B. Sodium citrate. Explanation: this question directly tests knowledge of tube additives and their specific uses, with light blue top tube and coagulation studies being the key identifiers. The light blue top tube contains sodium citrate, which works by binding to calcium, effectively preventing blood from clotting so that coagulation tests like PT, prothrombin time, and PTT, partial thromboplastin time, can be performed accurately. EDTA is in lavender tubes for hematology, heparin in green tubes for chemistry, and sodium fluoride in gray tubes for glucose preservation. Remember, light blue for coagulation, thanks to sodium citrate. Question 6. A phlebotomist is preparing to collect a blood culture using two bottles, aerobic and anaerobic. Which bottle should be inoculated first during the draw, assuming direct draw into the bottles? A. Aerobic bottle. B. Anaerobic bottle. C. Either bottle, the order doesn't matter. D. The bottle with the largest volume. Answer: A. Aerobic bottle. Explanation: this question assesses the specific procedure for collecting blood cultures, which is vital for accurate microbiology results. When using a butterfly needle setup for direct draw into the bottles, the aerobic, oxygen-loving, bottle should always be inoculated first, even though the anaerobic, oxygen-avoiding, bottle might seem to make more sense to draw first. This order is chosen because the air within the butterfly needle's tubing will be introduced into the first bottle, and placing it into the aerobic bottle ensures it receives oxygen without affecting the anaerobic specimen. Always prioritize the aerobic bottle first to maintain the integrity of the anaerobic sample. Question 7. A phlebotomist receives an order for a stat D dimer. Which tube color should be collected? A. Red. B. Light blue. C. Green. D. Lavender. Answer: B. Light blue. Explanation: this question tests the phlebotomist's ability to match a specific laboratory test to the correct tube type and additive, with stat D dimer being the critical test to identify. A D-dimer test is a coagulation study, used to help diagnose conditions like deep vein thrombosis, DVT, or pulmonary embolism, PE. Coagulation tests require a sodium citrate additive, which is found in the light blue top tube. Remembering that all coagulation tests, like PT, PTT, and D-dimer, utilize the light blue tube, will ensure you select the correct tube for accurate results. Question 8. What is the most critical piece of information a phlebotomist must confirm for positive patient identification before venipuncture? A. Patient's address and date of birth. B. Patient's first and last name. C. Patient's first name and medical record number. D. Patient's first and last name and date of birth. Answer: D. Patient's first and last name and date of birth. Explanation: this question emphasizes the paramount importance of positive patient identification, the single most critical step in preventing errors and ensuring patient safety. The keyword "most critical" highlights the need for the most robust identification method. While a patient's name is essential, combining it with their date of birth provides two distinct identifiers that significantly reduce the chance of misidentification, especially if two patients share the same name. Always use at least 2 unique identifiers from the patient's armband and verbal confirmation to ensure you are drawing from the correct person. Question 9. A patient is on anticoagulant therapy. After venipuncture, what special consideration should the phlebotomist take? A. Apply firm pressure for 10 to 15 seconds. B. Apply light pressure for 30 seconds. C. Apply firm pressure for a minimum of 5 minutes. D. Apply a tourniquet above the site for 2 minutes after the draw. Answer: C. Apply firm pressure for a minimum of 5 minutes. Explanation: this question addresses post-venipuncture care, specifically for patients at higher risk of bleeding, indicated by anticoagulant therapy. Anticoagulants, blood thinners, increase the patient's clotting time, making them prone to prolonged bleeding and hematoma formation after a venipuncture. Therefore, the phlebotomist must apply firm pressure to the site for a significantly longer duration, typically a minimum of 5 minutes, or until bleeding has completely stopped, to prevent these complications. Prioritizing patient safety, especially for those on blood thinners, means extending pressure application to ensure proper hemostasis. Question 10. When performing a dermal puncture on an infant for a heel stick, which area of the heel is considered most appropriate for the puncture? A. The center of the heel. B. The medial or lateral aspects of the plantar surface. C. The posterior curvature of the heel. D. Any area of the heel that is warm to the touch. Answer: B. The medial or lateral aspects of the plantar surface. Explanation: this question tests knowledge of proper dermal puncture sites for infants, which is crucial for safety and preventing injury. The key is dermal puncture on an infant and heel stick. The medial and lateral aspects of the plantar, bottom, surface of the heel are the safest areas for a heel stick because they are farthest from the calcaneus, heel bone, reducing the risk of bone injury or infection, which can lead to osteomyelitis. Puncturing the center or posterior heel is dangerous due to the proximity of nerves, tendons, and bone. Always aim for the designated safe zones on the heel. Question 11. Which tube contains an anticoagulant that preserves the cellular components of blood for hematology testing? A. Red top. B. Green top. C. Lavender top. D. Light blue top. Answer: C. Lavender top. Explanation: this question directly tests knowledge of tube additives and their function, particularly for hematology tests, with preserved cellular components and hematology testing as key indicators. The lavender, or purple, top tube contains EDTA, ethylenediamine tetrashic acid, which is a strong anticoagulant that works by binding calcium, preventing clotting while also preserving the cellular components of blood, red blood cells, white blood cells, and platelets, for complete blood count, CBC, and other hematological analyses. Other tubes like red, no additive, clots, green, heparin, chemistry, and light blue, sodium citrate, coagulation, serve different purposes. Remember, lavender equals hematology because of EDTA. Question 12. A phlebotomist must collect a blood specimen for a patient with a known allergy to latex. What immediate action should the phlebotomist take before starting the procedure? A. Use vinyl or nitrile gloves. B. Pre-medicate the patient with an antihistamine. C. Inform the patient that they must endure the latex. D. Use a smaller gauge needle to minimize skin exposure. Answer: A. Use vinyl or nitrile gloves. Explanation: this question addresses essential safety protocols for patients with allergies, focusing on latex allergy and immediate action. The most critical immediate step is to ensure that all equipment that will come into contact with the patient or the phlebotomist's hands is latex-free. This primarily means using non-latex gloves, such as vinyl or nitrile gloves, which are readily available in healthcare settings. Failing to do so could trigger a severe allergic reaction in the patient. Always confirm known allergies and select appropriate supplies to ensure patient safety and prevent adverse reactions. Question 13. Which of the following conditions would make a venipuncture site unacceptable? A. Petechiae. B. Sclerosis. C. Hematoma. D. Edema. Answer: B. Sclerosis. Explanation: this question challenges your understanding of various skin conditions that can affect venipuncture site selection. While petechiae, hematoma, and edema can make a site less ideal or require careful technique, sclerosis refers to hardened, cord-like veins that are typically damaged from repeated venipuncture or disease. Sclerotic veins are difficult to penetrate, painful for the patient, and yield poor blood flow, making them an unacceptable choice for venipuncture. Always palpate for vein elasticity and avoid sites that feel rigid or hardened to ensure a successful and less painful draw. Question 14. What is the correct order of draw for a capillary collection when collecting a CBC, BMP, and PKU? A. PKU, BMP, CBC. B. CBC, PKU, BMP. C. BMP, CBC, PKU. D. CBC, BMP, PKU. Answer: B. CBC, PKU, BMP. Explanation: this question specifically tests the order of draw for capillary, dermal, collections, which differs from venipuncture due to the rapid clotting process. For capillary draws, tests requiring whole blood, like a CBC, collected in a lavender microtube, should be collected first to prevent clotting and platelet aggregation. Followed by specific specialized tests like PKU, phenylketonuria, and then serum or plasma specimens, like a BMP, collected in green or tiger top microtubes, which can clot or separate more easily. Remembering the specific order, hematology first, then other additives, then serum/plasma, is crucial for accurate capillary blood results. Question 15. A phlebotomist is preparing to perform a venipuncture on a patient with visible petechiae on their arm after tourniquet application. What does this indicate? A. The patient is well hydrated. B. The tourniquet is applied too loosely. C. The patient has capillary fragility or a platelet abnormality. D. The patient has strong venous access. Answer: C. The patient has capillary fragility or a platelet abnormality. Explanation: this question tests the phlebotomist's ability to observe and interpret patient signs during the pre-analytical phase, specifically petechiae appearing after tourniquet application. Petechiae are tiny, pinpoint red or purple spots that appear on the skin due to small hemorrhages from broken capillaries. Their appearance after tourniquet application suggests increased capillary fragility or a platelet dysfunction, meaning the patient may bleed or bruise more easily. While it doesn't contraindicate the draw, it alerts the phlebotomist to apply pressure for longer post-draw and potentially use a lighter tourniquet pressure. Question 16. After drawing blood, a phlebotomist needs to prepare a slide for a peripheral blood smear. What is the most common angle for the spreader slide when making a good quality smear? A. 15 degrees. B. 30 degrees. C. 45 degrees. D. 60 degrees. Answer: B. 30 degrees. Explanation: this question tests a specific technical skill in specimen preparation, which is essential for accurate microscopic examination of blood cells. The peripheral blood smear is a key indicator of the task. When preparing a blood smear, holding the spreader slide at approximately a 30-degree angle allows for a thin, even distribution of blood across the slide, producing a feathered edge necessary for proper cell morphology evaluation. Angles too steep or too shallow can result in smears that are either too thick or too thin, making microscopic analysis difficult or impossible. Practice maintaining this angle for optimal smear quality. Question 17. Which of the following is the most appropriate way to dispose of a used needle after venipuncture? A. Recap the needle and dispose of it in a biohazard bag. B. Break the needle off the syringe and put it in a regular trash can. C. Immediately activate the safety mechanism and place it in a sharps container. D. Place the uncapped needle into a designated sharps container with 2 hands. Answer: C. Immediately activate the safety mechanism and place it in a sharps container. Explanation: this question focuses on critical safety protocols for sharps disposal, aiming to prevent needle stick injuries, which is paramount in phlebotomy. The keywords most appropriate way and used needle highlight the importance of immediate, safe disposal. The correct procedure is to activate the needle safety mechanism without delay and then promptly discard the entire needle holder assembly into a puncture-resistant sharps container, always using only one hand to avoid self-injury. Never recap, break, or place sharps in regular trash, as these actions significantly increase the risk of accidental needle sticks. Question 18. A phlebotomist needs to draw blood for a fasting glucose test. The patient states they had a small snack about 2 hours ago. What should the phlebotomist do? A. Proceed with the draw, as a small snack won't significantly affect the glucose level. B. Note the snack on the requisition form and proceed with the draw. C. Inform the nurse or physician and follow their instructions regarding the draw. D. Reschedule the patient for another day when they can fast for 12 hours. Answer: C. Inform the nurse or physician and follow their instructions regarding the draw. Explanation: this question evaluates the phlebotomist's understanding of pre-analytical variables, specifically the fasting requirement for a glucose test, and how to handle non-compliance. While a snack within the fasting window invalidates a strict fasting glucose, the phlebotomist's role is not to unilaterally cancel the test. Instead, the most professional and appropriate action is to communicate this crucial information to the ordering physician or nurse, who can then determine whether to proceed with the draw, and interpret results cautiously, reschedule, or order a different test. Always communicate non-compliance with pre-test instructions to the care team. Question 19. A phlebotomist is drawing blood from a patient with a strong, visible vein. However, the blood flow quickly diminishes and stops. What is the most likely cause of this issue? A. The vacuum in the tube was compromised. B. The needle went completely through the vein. C. The tourniquet was applied too tightly. D. The patient's blood pressure dropped suddenly. Answer: B. The needle went completely through the vein. Explanation: this question tests problem-solving skills during venipuncture, specifically when blood flow ceases unexpectedly from a seemingly good vein. The key clue is blood flow quickly diminishes and stops despite a strong, visible vein. This scenario most commonly indicates that the needle has been advanced too far, puncturing through both walls of the vein. When this happens, blood either stops flowing because the vein collapses around the needle, or a hematoma starts forming as blood leaks out the back wall. Slight withdrawal of the needle may sometimes re-establish flow, but often a redraw is needed if the vein is blown. Question 20. When collecting a specimen for a cold agglutinin test, What special handling requirement is necessary immediately after collection? A. Place the tube in an ice slurry. B. Protect the specimen from light. C. Keep the specimen warm at 37 degrees Celsius. D. Centrifuge the specimen immediately. Answer: C. Keep the specimen warm at 37 degrees Celsius. Explanation: this question assesses knowledge of special specimen handling, specifically for cold agglutinin tests, which are unusual and therefore tricky. Cold agglutinins are antibodies that react at colder temperatures, causing red blood cells to clump together, agglutinate. To ensure accurate results and prevent the agglutination from occurring in vitro, in the tube, before testing, the specimen must be kept warm, ideally at body temperature, 37 degrees Celsius, immediately after collection and during transport to the lab. This prevents the antibodies from clumping the red blood cells, which would invalidate the test. Remember, cold agglutinins need warm handling. Question 21. A phlebotomist must verify the integrity of a vacuum tube before venipuncture. How is this typically done? A. By checking the expiration date on the tube. B. By ensuring the stopper is securely in place. C. By shaking the tube to confirm the presence of additives. D. Both A and B. Answer: D. Both A and B. Explanation: this question highlights essential quality control steps in phlebotomy, focusing on ensuring proper tube function. The integrity of a vacuum tube is paramount for a successful blood draw and accurate results. Checking the expiration date confirms the tube's reagents are still active and the vacuum is intact, as vacuum integrity can degrade over time. Additionally, ensuring the stopper is securely in place prevents loss of vacuum and potential leakage. Both steps are critical to confirm the tube is ready for use and will perform as expected, ensuring the quality of the specimen. Question 22. A phlebotomist is asked to draw blood from a patient in isolation for Clostridioides difficile, C. diff. What personal protective equipment, PPE, is most important for the phlebotomist to don? A. Surgical mask and gloves. B. Gown and gloves. C. N95 respirator and gown. D. Gloves only. Answer: B. Gown and gloves. Explanation: this question tests knowledge of appropriate personal protective equipment, PPE, for specific isolation precautions, with Clostridioides difficile, C. diff, being the key pathogen. C. diff is primarily transmitted through contact, meaning direct or indirect contact with contaminated surfaces or items. Therefore, strict contact precautions are required, which typically include wearing a gown to protect clothing and gloves to protect hands upon entering the patient's room. Hand hygiene with soap and water, not alcohol-based sanitizer, is also critical upon leaving. Always don the correct PPE to prevent pathogen transmission. Question 23. What is the purpose of inverting anticoagulant tubes immediately after collection? A. To prevent hemolysis of the red blood cells. B. To allow the blood to clot properly for serum separation. C. To ensure proper mixing of the additive with the blood. D. To cool the specimen for transport to the lab. Answer: C. To ensure proper mixing of the additive with the blood. Explanation: this question addresses a critical post-collection step for tubes containing additives, specifically inverting anticoagulant tubes. Inverting the tubes, typically 5 to 10 times, gently, immediately after collection is essential to ensure that the anticoagulant additive mixes thoroughly with the blood. This proper mixing prevents microclot formation, which would render the specimen unsuitable for many tests, especially those requiring whole blood or plasma. Failing to invert properly can lead to inaccurate results or specimen rejection. Always gently invert tubes with additives to maintain specimen integrity. Question 24. A patient has an N4 infusion running in their left arm. The phlebotomist needs to collect blood for routine labs. What is the most appropriate site for venipuncture? A. Distal to the N4 site in the left arm. B. Proximal to the N4 site in the left arm. C. The right antecubital fossa. D. The N4 line itself. Answer: C. The right antecubital fossa. Explanation: this question evaluates proper site selection when a patient has an intravenous N4 line, a common scenario in healthcare. The presence of an N4 infusion running in their left arm means that arm should generally be avoided for blood collection. Drawing from the same arm, especially distal to the N4, risks diluting the blood specimen with the N4 fluids, leading to inaccurate test results. The most appropriate and safest option is to choose the contralateral, opposite, arm, in this case, the right antecubital fossa, which is free of an N4. Never draw from an active N4 line unless specifically trained and instructed for specialized situations, which is beyond general phlebotomy scope. Question 25. What would be the most appropriate action if a patient complains of severe pain during venipuncture that radiates up their arm? A. Try to reposition the needle slightly to alleviate the pain. B. Withdraw the needle immediately. C. Apply a cold pack to the insertion site and continue. D. Ask the patient to tolerate it for a few more seconds. Answer: B. Withdraw the needle immediately. Explanation: this question addresses a critical patient safety scenario, a patient experiencing severe, radiating pain during venipuncture. Radiating pain is a strong indicator of potential nerve involvement or injury. The keyword most appropriate action emphasizes the need for immediate, decisive intervention to prevent further harm. Continuing the draw or attempting to reposition the needle could worsen nerve damage. The immediate priority is to remove the needle, assess the patient, and report the incident according to facility policy. Patient well-being always takes precedence. Question 26. When preparing to perform a venipuncture, the phlebotomist notices the patient's arm is cold to the touch. What action might help improve vein visibility and palpation? A. Apply ice to the area. B. Ask the patient to clench their fist vigorously. C. Apply a warm compress to the site for a few minutes. D. Have the patient stand up for a few minutes. Answer: C. Apply a warm compress to the site for a few minutes. Explanation: this question addresses techniques to improve vein accessibility, specifically when a patient's arm is cold to the touch. Cold temperatures cause vasoconstriction, making veins constrict and become harder to see and palpate. Applying a warm compress or warm pack to the intended venipuncture site for several minutes promotes vasodilation, vein widening, which increases blood flow and makes veins more prominent and easier to access. While clenching the fist can help, warming the arm is generally more effective for cold, constricted veins. Question 27. Which of the following is the primary reason for performing blood cultures? A. To monitor glucose levels in diabetic patients. B. To assess kidney function. C. To detect the presence of microorganisms in the blood. D. To evaluate coagulation disorders. Answer: C. To detect the presence of microorganisms in the blood. Explanation: this question tests the fundamental purpose of a specific lab test, blood cultures. The primary reason for collecting blood cultures is to identify microorganisms, such as bacteria or fungi, that are circulating in the bloodstream, a condition known as bacteremia or septicemia. This detection is crucial for diagnosing serious infections like sepsis and guiding appropriate antibiotic treatment. While other tests monitor glucose, kidney function, or coagulation, blood cultures are uniquely designed to detect active bloodstream infections. Question 28. A phlebotomist is performing a glucose tolerance test, GTT. After the patient drinks the glucose solution, how frequently must blood samples be collected? A. Every 15 minutes. B. Every 30 minutes. C. Every hour for a set period. D. Only once at 2 hours. Answer: C. Every hour for a set period. Explanation: this question assesses knowledge of specific procedures for a glucose tolerance test, GTT, a common special collection. After the patient consumes the glucose solution, blood samples are typically collected at specific intervals, most commonly at 1 hour, 2 hours, and sometimes 3 hours, depending on the specific protocol for the GTT ordered, e.g., 2-hour GTT, 3-hour GTT. This series of timed samples allows the healthcare provider to evaluate how quickly the patient's body processes glucose. While the exact duration varies, the collection interval is typically hourly, not every 15 or 30 minutes. Question 29. What type of consent is given by a patient who extends their arm for a venipuncture? A. Informed consent. B. Implied consent. C. Expressed consent. D. Verbal consent. Answer: B. Implied consent. Explanation: this question differentiates between types of patient consent in a practical phlebotomy scenario. When a patient voluntarily extends their arm after being asked to have blood drawn, they are providing implied consent. This means their actions, rather than explicit words, indicate their permission for the procedure. Informed consent typically involves a detailed discussion and often a signed form, while expressed and verbal consent are explicit verbal agreements. Implied consent is common for routine, low-risk procedures where the patient's cooperation clearly indicates agreement. Question 30. A phlebotomist observes frost on the outside of a blood specimen tube upon arrival in the lab. What is the most likely reason for this, and what is the appropriate action? A. The specimen was exposed to extreme heat. Reject the specimen. B. The specimen was placed in an ice bath, except if ordered for specific tests like ammonia. C. The specimen was underfilled. Reject the specimen. D. The specimen was agitated excessively. Accept with caution. Answer: B. The specimen was placed in an ice bath, except if ordered for specific tests like ammonia. Explanation: this question tests knowledge of proper specimen handling and transport conditions, specifically relating to temperature. Frost on the outside of a tube immediately indicates that the specimen has been placed in an ice bath or refrigerated. While most specimens are kept at room temperature or slightly cooled, certain tests, like ammonia or lactic acid, require chilling in an ice slurry immediately after collection to preserve analytes. Therefore, if the test ordered is one that needs chilling, the specimen is acceptable, otherwise, it would be a temperature deviation requiring investigation. Question 31. A phlebotomist is about to perform a venipuncture on a patient who has bilateral arm bandages from recent surgery. What is the most appropriate alternative site for venipuncture? A. The leg or foot veins. B. A central venous catheter, CVC. C. The antecubital fossa over the bandages. D. The dorsal hand veins. Answer: D. The dorsal hand veins. Explanation: This question tests the phlebotomist's ability to select an alternative venipuncture site when primary sites are unavailable, highlighted by bilateral arm bandages. When the antecubital fossae of both arms are inaccessible, the veins on the dorsal, back, side of the hand are the next preferred alternative for venipuncture. They are often visible, relatively accessible, and generally safer than leg/foot veins, which carry a higher risk of complications like phlebitis and infection, especially in diabetic patients or those with peripheral vascular disease. Drawing from a CVC is typically performed by trained nursing staff, not phlebotomists. Question 32. What is the term for a localized collection of blood outside the blood vessels, commonly seen after venipuncture due to blood leakage? A. Edema. B. Petechiae. C. Hematoma. D. Hemolysis. Answer: C. Hematoma. Explanation: this question asks for the correct medical term describing a common complication of venipuncture. A localized collection of blood outside the blood vessels directly describes a hematoma. This occurs when blood leaks from the vein into the surrounding tissue, often appearing as a bruise or swelling at the venipuncture site. Edema is swelling due to fluid accumulation, petechiae are tiny pinpoint hemorrhages, and hemolysis is the breakdown of red blood cells within the sample. Recognizing a hematoma is crucial for proper post-puncture care and patient education. Question 33. A phlebotomist observes a patient has a pulsatile, bright red flow of blood during venipuncture. What is the most likely cause, and what immediate action should be taken? A. Venous puncture, continue the draw. B. Arterial puncture, remove the needle and apply firm pressure for 10 minutes. C. Capillary puncture, reposition the needle. D. Vein collapse, withdraw the needle and try a new site. Answer: B. Arterial puncture, remove the needle and apply firm pressure for 10 minutes. Explanation: this question tests the phlebotomist's ability to recognize and respond to an accidental arterial puncture, a serious complication. The key clues are pulsatile, bright red flow, which are characteristic signs of arterial blood rather than venous blood, which flows steadily and is darker red. If an arterial puncture occurs, the immediate and critical action is to withdraw the needle, apply firm pressure to the site for a minimum of 5 to 10 minutes, longer than venous pressure, and notify nursing staff or the physician. This prevents significant bleeding and hematoma formation. Question 34. What is the correct order of draw for evacuated tubes when collecting a blood culture, a PTT, and a CBC? A. CBC, PTT, blood culture. B. Blood culture, PTT, CBC. C. PTT, CBC, blood culture. D. Blood culture, CBC, PTT. Answer: B. Blood culture, PTT, CBC. Explanation: this question assesses a core concept in phlebotomy, the correct order of draw for multiple tubes. Following the CLSI, Clinical and Laboratory Standards Institute, recommended order of draw is crucial to prevent cross-contamination of additives, which can lead to inaccurate test results. The standard order begins with blood cultures, sterile collection, to avoid contamination, followed by coagulation tubes, like PTT in light blue top, then EDTA tubes, like CBC in lavender top, and so on. Remember this sequence to ensure specimen integrity for all tests drawn. Question 35. A phlebotomist has an order for a 24-hour urine collection. What is the most important instruction to give the patient regarding the start and end of the collection period? A. Collect every urine specimen during the 24 hours. B. Discard the first morning urine specimen on day 1, then collect all subsequent urine for 24 hours. C. Collect the first morning urine specimen on day 1, then discard all subsequent urine for 24 hours. D. Collect urine for 24 hours starting any time, including the first void. Answer: B. Discard the first morning urine specimen on day 1, then collect all subsequent urine for 24 hours. Explanation: this question tests knowledge of specific patient instructions for a 24-hour urine collection, which is designed to measure the total amount of a substance excreted over a full day. The most critical instruction is to discard the very first urine specimen of the collection period, e.g., first morning void on day 1. This start time then marks the beginning of the 24-hour collection, and all subsequent urine produced, including the first morning urine exactly 24 hours later, must be collected. This ensures accurate measurement of daily excretion without including urine from the previous day's metabolic activity. Question 36. After a venipuncture, a patient begins to show signs of pallor, sweating, and says they feel dizzy. What is the immediate action the phlebotomist should take? A. Reassure the patient and continue with the draw. B. Have the patient stand up and walk around to get fresh air. C. Lay the patient flat, elevate their legs, and apply a cold compress to their neck. D. Give the patient a sugary drink immediately. Answer: C. Lay the patient flat, elevate their legs, and apply a cold compress to their neck. Explanation: this question describes classic signs of syncope, fainting, which is a common and serious complication during or after venipuncture. The keywords pallor, sweating, and dizziness are clear indicators of an impending faint. The immediate and most crucial action is to lay the patient flat with their legs elevated to increase blood flow to the brain, helping to prevent or alleviate the faint and reduce the risk of injury from falling. Applying a cold compress can also help. Never have a patient stand up if they feel dizzy. This can worsen the fainting episode. Question 37. Which of the following is an example of a pre-analytical error in phlebotomy? A. The lab analyzer malfunctions during testing. B. The phlebotomist collected the specimen in the wrong tube. C. The pathologist misinterprets the test results. D. The specimen is contaminated during laboratory processing. Answer: B. The phlebotomist collected the specimen in the wrong tube. Explanation: this question distinguishes between different phases of laboratory testing errors. Pre-analytical error refers to mistakes that occur before the specimen is actually tested in the laboratory. Collecting a specimen in the wrong tube is a classic example of a pre-analytical error because it happens during the collection phase and can lead to inaccurate results or specimen rejection by the lab. Malfunctioning analyzers, misinterpretation of results, and contamination during processing are analytical or post-analytical errors, respectively. Understanding these phases helps identify where errors most frequently occur. Question 38. A phlebotomist is using a winged infusion set, butterfly needle, for a blood draw. Why is it important to draw a discard tube, or first tube that is then discarded, when collecting a light blue top tube with a butterfly? A. To remove air from the butterfly tubing. B. To ensure proper blood flow for subsequent tubes. C. To prevent hemolysis of the specimen. D. To clean the needle before drawing. Answer: A. To remove air from the butterfly tubing. Explanation: this question specifically addresses a unique consideration when using a winged infusion set, butterfly needle, for a light blue top tube. The tubing of a butterfly needle contains a small amount of air. If a light blue, sodium citrate, tube is the first and only tube drawn, this air can fill part of the tube, leading to an underfilled tube and an incorrect blood-to-anticoagulant ratio. The discard tube, which can be a plain red or an extra light blue tube that is then discarded, removes the air from the tubing, ensuring the next light blue tube fills completely with blood and maintains the correct ratio for accurate coagulation testing. Question 39. What is the most significant risk of prolonged tourniquet application, longer than 1 minute, during venipuncture? A. Hemolysis. B. Petechiae. C. Hemoconcentration. D. Nerve damage. Answer: C. Hemoconcentration. Explanation: this question tests understanding of potential complications from improper tourniquet use, specifically prolonged tourniquet application. When a tourniquet is left on for longer than 1 minute, it causes blood to pool in the area, leading to an increase in the concentration of larger molecules, such as proteins and blood cells, within the plasma. This phenomenon is called hemoconcentration and can lead to falsely elevated test results for certain analytes. While petechiae might appear, hemoconcentration is the most significant impact on test accuracy. Always remove the tourniquet as soon as blood flow is established or within 1 minute. Question 40. A phlebotomist is asked to collect a specimen for a blood alcohol test, BAC, for legal purposes. Which antiseptic should not be used for site preparation? A. Povidone iodine, betadine. B. Chlorhexidine gluconate. C. Isopropyl alcohol. D. Benzalkonium chloride. Answer: C. Isopropyl alcohol. Explanation: this question assesses knowledge of specific procedures for forensic blood collection, highlighted by blood alcohol test, BAC, for legal purposes. Isopropyl alcohol, the most common antiseptic for routine venipuncture, contains alcohol itself. Using it for a blood alcohol test can contaminate the sample and lead to falsely elevated results, compromising the integrity of the legal evidence. Therefore, a non-alcohol-based antiseptic like povidone iodine, betadine, chlorhexidine gluconate, or benzalkonium chloride must be used for skin preparation. Always choose an alcohol-free antiseptic for BAC collections. Question 41. Which blood component is collected when a red top tube is spun down in a centrifuge? A. Plasma. B. Serum. C. Whole blood. D. Red blood cells. Answer: B. Serum. Explanation: this question tests understanding of blood components and how they are separated, specifically focusing on a red top tube and centrifugation. A red top tube does not contain an anticoagulant, meaning the blood collected in it will clot. After clotting, when the tube is centrifuged, the solid cellular components, clot, separate from the liquid portion, which is called serum. Serum is plasma without the clotting factors and is commonly used for chemistry, immunology, and blood bank tests. In contrast, tubes with anticoagulants yield plasma after centrifugation. Question 42. A phlebotomist is drawing blood from a pediatric patient. The child's parent asks if they can hold the child during the draw. What is the most appropriate response? A. Politely decline, as it might make the child too comfortable. B. Allow the parent to hold the child, ensuring the child's arm is properly immobilized. C. Only allow the parent to observe from a distance. D. Suggest that the parent step out of the room to avoid distress. Answer: B. Allow the parent to hold the child, ensuring the child's arm is properly immobilized. Explanation: this question addresses professional and compassionate care in pediatric phlebotomy, focusing on involving the parent. Allowing a parent to hold and comfort their child during a blood draw is generally the most appropriate approach, as it can significantly reduce the child's anxiety and help with cooperation. The key is to ensure the parent can safely immobilize the child's arm without interfering with the phlebotomist's technique. This collaborative approach promotes a more positive experience for the child and often leads to a more successful draw. Question 43. A phlebotomist performs a dermal puncture on a patient. After collecting the first drop, which is usually contaminated with tissue fluid, what should the phlebotomist do? A. Collect the first drop, as it contains the most concentrated blood. B. Wipe away the first drop of blood with a clean gauze. C. Squeeze the finger vigorously to obtain more blood. D. Apply a tourniquet to the finger to increase blood flow. Answer: B. Wipe away the first drop of blood with a clean gauze. Explanation: this question tests a critical step in dermal puncture technique, specifically concerning the first drop of blood. The first drop of blood from a dermal puncture, finger stick or heel stick, is typically contaminated with tissue fluid, interstitial fluid, which can dilute the specimen and interfere with accurate test results. Therefore, it is essential to wipe away this initial drop with clean gauze. The subsequent drops will be purer blood, suitable for collection. Never squeeze vigorously, as this can cause hemolysis and further dilute the sample with tissue fluid. Question 44. What is the purpose of palpating the vein before venipuncture? A. To assess the patient's pain tolerance. B. To determine the size, direction, and depth of the vein. C. To check for signs of infection. D. To cleanse the skin thoroughly. Answer: B. To determine the size, direction, and depth of the vein. Explanation: this question clarifies the essential pre-analytic step of palpating a vein. Palpation, which means to examine by touch, is crucial for successful venipuncture. It allows the phlebotomist to feel the vein's elasticity, determine its size, how wide it is, trace its path, direction, and estimate how deep it lies beneath the skin. This tactile assessment helps select the best vein for a successful and safe puncture, even if the vein is not visibly prominent. Good palpation skills improve success rates and reduce patient discomfort. Question 45. Which department in the laboratory typically performs a complete blood count, CBC? A. Chemistry. B. Microbiology. C. Hematology. D. Blood bank. Answer: C. Hematology. Explanation: this question tests knowledge of laboratory departments and the types of tests they perform. A complete blood count, CBC, is a fundamental test that measures various components of blood, including red blood cells, white blood cells, and platelets. The department specializing in the study of blood and blood-forming tissues is hematology. Chemistry performs tests on serum/plasma, microbiology identifies pathogens, and the blood bank deals with blood typing and transfusions. Knowing which department performs which tests is crucial for proper specimen routing and understanding lab operations. Question 46. What is the standard angle of needle insertion for a routine venipuncture using an evacuated tube system? A. 5 to 10 degrees. B. 15 to 30 degrees. C. 45 to 60 degrees. D. 90 degrees. Answer: B. 15 to 30 degrees. Explanation: this question asks for the correct needle insertion angle for routine venipuncture, a fundamental technique. For most venipunctures using an evacuated tube system, the needle should be inserted at a 15 to 30 degree angle relative to the skin. This angle is shallow enough to enter the vein without going through it completely and deep enough to ensure proper penetration. Angles outside this range increase the risk of missing the vein, going through the vein, or causing unnecessary pain. Always maintain a shallow, controlled angle for optimal vein access. Question 4-7. A phlebotomist is collecting a specimen for a prothrombin time, PT, and activated partial thromboplastin time, APTT. What information is critical to document along with the specimen? A. The patient's last meal time. B. The exact time the specimen was collected. C. The patient's height and weight. D. The type of bandage applied after the draw. Answer: B. The exact time the specimen was collected. Explanation: this question highlights the importance of accurate documentation, especially for time-sensitive tests like prothrombin time, PT, and activated partial thromboplastin time, APTT, which are coagulation studies. Coagulation tests are often ordered to monitor medication effectiveness or assess bleeding risk, and their results can be influenced by collection time relative to medication dosages or other clinical events. Therefore, documenting the exact time of collection is critical for accurate interpretation by the physician. Always ensure all relevant information, especially time-sensitive data, is precisely recorded for proper patient care. Question 48. What is the most appropriate action if a patient refuses a blood draw after the phlebotomist has explained the procedure? A. Attempt to persuade the patient to comply. B. Inform the patient that the doctor requires it. C. Document the refusal and notify the nurse or ordering physician. D. Proceed with the draw, as it is a doctor's order. Answer: C. Document the refusal and notify the nurse or ordering physician. Explanation: this question addresses patient rights and professional conduct when faced with a patient's refusal, which is a critical ethical and legal consideration. Patients have the right to refuse medical procedures, even if ordered by a physician. The most appropriate action is to respect the patient's decision, document their refusal accurately, and immediately notify the nurse or ordering physician so they can address the patient's concerns or seek alternative diagnostic methods. Never force a patient to undergo a procedure, as this violates their rights and can have serious legal consequences. Question 49. When performing a venipuncture, a phlebotomist notices that the tube is filling very slowly, and a hematoma is beginning to form at the insertion site. What is the most likely cause? A. The tourniquet was removed too early. B. The needle is partially out of the vein or not fully seated. C. The needle gauge is too small for the vein. D. The patient is dehydrated, causing slow blood flow. Answer: B. The needle is partially out of the vein or not fully seated. Explanation: this question tests troubleshooting skills during venipuncture, focusing on two simultaneous issues: slow filling and hematoma formation. When a tube fills slowly, and a hematoma forms, it strongly suggests that the needle is not fully or properly inserted into the vein. It might be partially out, or only the bevel, the slanted opening of the needle, is in the vein, allowing blood to leak into the surrounding tissues rather than filling the tube efficiently. This leakage creates the hematoma. Repositioning the needle slightly, if ethical, or withdrawing and restarting may be necessary. Question 50. Which of the following is the last step a phlebotomist should perform immediately before disposing of the needle after a successful venipuncture? A. Engage the safety mechanism. B. Apply a bandage to the patient's arm. C. Label the specimen tube at the patient's bedside. D. Remove the tourniquet. Answer: A. Engage the safety mechanism. Explanation: This question assesses the correct sequence of post-venipuncture steps, specifically focusing on the immediate action regarding the needle. After successfully removing the needle from the patient's arm, the last step performed on the needle itself before disposal is to immediately activate or engage the safety mechanism. This crucial step prevents accidental needle stick injuries. While removing the tourniquet and labeling the tube are vital post-draw steps, they occur before or concurrently with needle withdrawal, and the safety mechanism is activated right after the needle is out of the patient and before it goes into the sharps container.